Thank you again for joining us. So I want to kick things off with your team with, Heritage Biologics prides yourselves on looking at the patient experience. Can you talk about some of your organizational efforts that you have made in this area?
Absolutely. I can kick it off and just give a quick introduction to Heritage. And when we started about 6 years ago, our team came together and said, what have been some of the best practices from the previous organizations you've been with, and what are the things that we want to continue. So especially for myself, I am a nurse by background, came from the hospital setting, and I was also a nurse educator. And so I really saw that once these patients are sent home, they're really on their own. And so being totally new to the specialty pharmacy world, our leadership team kind of sat together and was like, how can we help coordinate and bridge that gap when a patient is either discharged from the hospital or when they get that new diagnosis that they haven't had. And so when originally back in 2015, we partnered and became a member of the Barrel Institute, which is a patient experience organization that started here in the United States. It's now grown to be an international organization that members are a part of. And it's really just a community of professionals who are focused on making that patient experience journey a smooth one, and figuring out how can we as healthcare providers all come together to help patients across their journey and navigating the complex healthcare world. So Heritage was the first pharmacy to really develop a formalized patient experience program. So we utilize the Barrel Institute's curriculum for patient experience, and several of our staff members have their certificate in patient experience leadership, but then really use that as a foundation to building our program. So for example, we've got patient experience navigators who are assigned to patients as soon as they're admitted to our service. And their job is really to help support that patient and surround them in layers of resource. So we say, our job is obviously to get their medication to them as their specialty pharmacy, but sometimes pharmacy can be the smallest part of what we do. From going and enrolling them in our patient portal and telehealth app, coordinating services with other healthcare providers, even, within one health system. Oftentimes, physicians in different specialties can't necessarily access the information from other areas of that health system. And so really just providing a way for information to be communicated across all lines, and then really giving patients a voice back in their care. I would say some other things our patient experience team does is helping patients connect to the community. So making sure that they are aware of the different organizations that are available to them. As Sheila was saying, COVID kind of projected all of us here into the technology space. And so, these support groups and different things that patients, especially if they've got new diagnoses, don't necessarily have access or knowledge of. So making sure that we get that to them.
Yeah, and I feel like technology is becoming a theme here, but I think you took a little bit of a different focus when you were talking about just the importance of connecting all of the different healthcare providers together from a technological perspective, so everybody can see what's going on with that patient. And I love the focus of the patient experience and making that a formal program. Because at the end of the day, that's what we're talking about, right? Is the patient and making sure that they have a positive experience. And we know if they don't, then they're not going to have a positive therapy experience as well. So I think that's great. Brianna, can you talk about some of the results that you've seen from your patient experience program?
Yes, definitely. You kind of teed it up for me, exactly what you said. So, with all the different initiatives that we have implemented throughout the years, we've really truly seen that a positive patient experience truly leads to positive patient outcomes. Patients really just want to know that they are being heard. And when it comes to living with a rare disease, they need to know that they really have someone in their corner that truly cares. As most of us are specialty pharmacy providers, we all really hold a very unique role, and patients place a tremendous amount of trust in us, whether you're the nurse, whether you're a pharmacist, whether you're on that patient experience team. They all just place a tremendous amount of trust in us. And so while we may all feel like we're just doing our job every day, we can have, even just with small actions, have a profound, impact on patients. So Amanda had kind of mentioned, our patient experience navigators, they have valuable, information that they gather from those patients on their recent, infusion visits. So they have regular touch points with them, touch base, see how did your infusion go, whether they're experiencing any side effects from the therapy, and then whether they have any outstanding needs that we might be able to assist with, whether it's specifically related to their therapy or something that's kind of going on in their world, whether that be at home or a community resource need that we might be able to assist with. And so some of the powerful recurring themes that we hear from our patients, I kind of pulled a couple of our survey comments, and just some recent ones we've had are, the pharmacist is very thorough, never rushes on the phone with me. She's very knowledgeable, makes me feel confident in her care. The nurse is very thorough, professional, and friendly. Everything was explained fully and easy to understand. Heritage Biologics has been consistently so attentive to my medical journey, and also said has been the most attentive medical care I have ever received. I mean, I'm not sure how we could have asked for anything better there. So we truly take this, feedback and take it to heart, because we know that we're having a profound impact on patients. And then some that are not related to their therapy. One of our navigators was applauded for helping them with all the resources that they provided, without which they would have lost their house. So that seems, something that we didn't ever think we would be able to impact, but here we are, setting people up with community resources that really just bring, bring home the, the impact that we have as providers. So as part of our therapeutic management program, we gather our survey data, like I've mentioned. And so our net promoter scores, we ultimately, we want positive and not so positive feedback. If there's ever, a way that we can do better, we certainly would like to get that information. So, ultimately the clinician is going into a patient safe space. So we do home infusion therapies at our pharmacy. And so it's really important for us to make sure that interaction with the patient is positive. So if the nurse, maybe didn't connect well, or excuse me, if the patient didn't connect well with the nurse, that's really important for us to know, so that we can get a different nurse in there for the next time, so that, they have a good experience.
Excellent, excellent. So actually, there's a lot of great chat going on. Amanda, your reference to the Barrel Institute got some folks excited, and we might have some referrals to that. I think as a result of that, I think that was answered in the chat. So the Barrel Institute, excellent.
Yeah, and we would love to have more pharmacies a part of that, because we are oftentimes the outsiders that are, when we get together for the different conferences and do a lot of education with the other providers in the healthcare community on really what is specialty pharmacy or pharmacy in general, and how we can really impact patients. So please do.
Excellent, excellent. So it sounds like you have obviously you have a very hands-on approach. Some of that feedback that you shared, Brianna, just overwhelming. How do you, or what strategies do you use if you have a patient that just really doesn't want to be engaged in the clinical services that you're providing and those touch points? Do you have any strategies for how you try to genuinely get them engaged so that they will interact with you on another level?
Yeah, I might, as Amanda, she's overseen our patient experience department for several years, so I might let her answer that, because we certainly experience that. Every patient is different.
Yeah, and I think it's about meeting patients at where they are. So, all of us are probably very familiar. Patients have a variety of care that they want to experience. So some are very hands-on. They've got a lot of questions. They want to be communicating or almost over communicating. But then there are those patients who are more independent and more quiet. And so I think it's just really figuring out different techniques at being able to engage that patient. So here at Heritage, we do patient experience training on an ongoing basis, and we utilize, of course, as I said, the Barrel Institute's curriculum, but from different organizations such as Cleveland Clinic and other premier teaching institutions, but using things like service recovery, so and empathy, communication techniques, so hearing patients and being able to respond to them. I think it's also, we've had to be flexible. So if we talk about technology, we are at the day and age, especially with the younger generation, of people that don't want to talk on the phone, they only want to text. So figuring out how, as an organization, we can meet their needs, but still stay within guidelines and regulatory compliance that we have to maintain. So it's definitely a work in progress. And I think organizations have to be able to be flexible at really kind of going with the flow. And as things evolve and changes over the time, figuring out how we can best meet patient needs in that manner.
Absolutely. Meeting the patients where they are. That's going to give them the best experience, right?